My guest joins me to discuss his career journey into public health, serving tribal communities by way of a fellowship program. You're listening to the PHEC podcast, episode 306. The field of public health is so broad, overlapping multiple industries. With epidemiology at the core of public health, there are an unlimited number of ways to target specific populations, health conditions, environmental issues, and causes that matter most to you. My name is Dr. Huntley, and I'm the host here on the Public Health Epidemiology Conversations podcast. I'm an epidemiologist, consultant, and entrepreneur with over 20 years of experience in healthcare and public health. On this podcast, my guests and I engage in conversations that demonstrate the importance of public health and epidemiology across a variety of industries, helping you think outside the box and inspire greater positive impact in communities around the world. Now, let's dive into the topic of this brand new episode. Greetings, everyone, and thank you for joining me on this episode. This episode is part of a special sponsored series of episodes where you'll learn about the Tribal Epidemiology Centers, often referred to as TEC, through my conversations with public health professionals working with the community at each of the centers. My guest on this episode is Erik Ohlrogge. He joins me to discuss his career journey and work that he's currently doing as program director and epidemiologist at Great Lakes Intertribal Epidemiology Center. During our conversation, Erik describes his career path, which includes participation in a fellowship program. He also provides a definition of epidemiology that I think you'll appreciate, as well as some valuable tips at the end. Let me formally introduce him now, and then I'll connect our conversation. Erik Ohlrogge is a program director and epidemiologist at the Great Lakes Intertribal Epidemiology Center located in Wisconsin. Great Lakes Intertribal Epidemiology Center is a program of the Great Lakes Intertribal Council, which is driven to enhance the quality of life for all Native people. Since 1996, Great Lakes Intertribal Epidemiology Center has served the 34 federally recognized tribes, 4 urban Indian communities, and 3 Indian Health Service units within the Bemidji Indian Health Service area across Michigan, Minnesota, Wisconsin, and Chicago, Illinois. Erik's current work prioritizes leading programs that support public health data, capacity, and leadership in and across a variety of projects. As part of this, he works to understand how context affects health and how to implement programs that create equitable opportunities for health. For example, he supports environmental health work in tribal education agencies and child care facilities, as well as public health surveillance programs. He also works on supporting tribal public health and building public health infrastructure within tribal communities to accelerate disease prevention and health promotion. Erik has earned a Master of Science in Global Health and a Bachelor of Arts in Biology. He previously worked at the Wisconsin Department of Health Services as a team lead for the Wisconsin COVID-19 response team and as a Wisconsin Population Health Service Fellow. Let's connect my conversation with Erik right now. Hi, Erik. Welcome to the podcast. How are you?
Hi, Dr. Huntley. I'm good. Thank you for having me on the podcast.
I'm happy to have you here. And I want to dive into our conversation. We've been chatting for a little bit, getting kind of set up and ready for the recording. So I am looking forward to this. Let's jump in. Let's start with you telling everyone a little bit about yourself.
So my name's Erik Ohlrogge. I am a program director at the Great Lakes Intertribal Epidemiology Center. Most people call it GLITEC based on its acronym. I get the opportunity to work with a bunch of really incredible diverse communities in the Great Lakes region, working on public health and epidemiology projects. For example, I get to work on a variety of environmental health projects. We're trying to get PFAS testing and drinking water program started. We have blood testing program as well. We work on vaccine communication, a bunch of different epidemiology things as well, including data linkages, trying to promote better public health data for American Indians and Alaska Natives. So really a bunch of really incredible projects with a bunch of incredible people. And that's kind of what I do now. I can talk a little bit about how I came to the Great Lakes Intertribal Epidemiology Center. I don't know.
This is perfect because my first question or next question is that let's kind of back a little bit and work our way up to how you got to where you are now. So I'd love to hear, when did you first learn about public health and become interested in public health as a career?
I think I kind of fell into public health actually, and I just had a bunch of really incredible mentors and then people in my life who sort of ended up nudging me towards public health. Really early on in high school in my bachelor's, I hadn't really heard of public health. I didn't really know it was a thing. I didn't really know what public health did. And initially I'd wanted to become a doctor. My dad's a family practice doctor, and I always thought that would be in the cards for me. And then I just through a bunch of different experiences, courses, and projects that I worked on, I started to emphasize prevention predominantly over treatment, which I thought was really fascinating because then there are all these intersecting like systems, policies, ways of approaching healthcare that I hadn't really considered. And then a couple mentors in my bachelor's nudged me to look beyond medical school at, like a public health or global health type program. And I actually ended up applying to a global health program. It's based out of the Netherlands, which was absolutely fascinating and eye-opening. And it really helped me learn a lot about how there are these prevention-focused ways of approaching healthcare and how that can be so much more beneficial than these treatment-focused approaches that we often have. And then also like how things like colonialism on top of all of that affect the systems which we live in. And I thought that was really fascinating. Bunch of incredible mentors and then just lucky opportunities and experiences led me here.
Yeah, I can relate to that. I know for myself, I started out pre-med and a lot of us did as I, talked to folks on the podcast. And then there's this point where we learn about either for you it's the prevention, the attraction to the prevention model. And for me, it was the population, I can really impact and help populations of people at a time as opposed to one at a time. So a lot of us were converted or diverted off, that path and kind of found what we really were looking for. I just didn't know that it was a thing. So yeah, it's really interesting to hear people's journey at that point.
It's amazing how there are through lines like this, right? It's one of the through lines that I oftentimes see is just this exposure, right? I mean, don't really know it exists or it's out there. And then people come to this idea and then end up discovering public health via the focus on the population or prevention, what have you.
So it sounds like you had an introduction to some of the challenges that tribal populations face early on in education. So how did you end up working at the Tribal Epidemiology Center?
That's a really good question. So again, kind of through a combination of like really incredible mentors that I've had in my life and then also just lucky life experiences. I graduated from my master's right before the COVID-19 pandemic. I graduated with Master's of Science in Global Health. We did research, internship, immersion experiences for our masters. We had two of them. One of them it focused on fishing and traditional systems like food gathering in Greenland and how that intersects with public health and all these international systems. It was absolutely fascinating. And through that, I was connected with my thesis advisor, who I worked with on social determinants of health in remote Northern Ontario flying communities. So people who live in these communities have like a really unique context that they live in, and it's influenced by really unique like policy context as well and like historical context because they're predominantly First Nations communities. There's like a lot of opportunity for growth and for doing things better in response to community needs. And I did my thesis on sort of that whole system. Graduated, COVID-19 happened, and then sort of found myself back home in Wisconsin in the middle of the pandemic, just trying to figure out what I can do. And then I ended up getting a job with the Wisconsin Department of Health Services to work on the COVID response team task force. And I became a team lead for our contact tracing efforts. And then I learned a lot through there. And through that, I was connected to a person who had done this thing called the Wisconsin Population Health Service Fellowship, which is a 2-year fellowship. It connects young public health professionals with different organizations within the state of Wisconsin to try and focus on health equity and equitable health outcomes. And like the fellowship is absolutely fantastic. Like I can't say enough positive things about it and the people who I've been connected with through the fellowship. But essentially the fellowship placed me at the Great Lakes Intertribal Epidemiology Center, and I was a fellow for there a little while. Then I ended up applying to a job here, and that's how I came to be here.
I think that's great. Great story, great journey, because a lot of this is sort of circumstance. Like you said, a lot of things played into this. But I'm really glad to hear how you did get here, because it sounds like a lot of your education, was preparing you for this type of work. It's a great fit. It's a unique set of skills needed for the work with tribal populations, I think.
Very much so. Definitely like community driven, community focus is really important. And then, just communication, empathy, like just being like humility as well, being able to admit I'm wrong and step back and realize for a lot of things I'm not really the expert in the room, right? So really good skill set. A lot of cool experiences that have helped me develop that. So I'm lucky.
Yeah. Let's talk a little bit more about what you currently are doing. Can you describe more about your work day to day, or more about the specifics of what you're responsible for?
Yeah. So my current role is the Indian Health Service Epidemiology Cooperative Agreement Program Director, which I think is like I get a lot of opportunities to do really fascinating things with fascinating people. How do I describe my day-to-day role? A lot of meetings. Predominantly, I help lead and coordinate projects and facilitate people who I work with, facilitate their work on these projects. So a couple of examples would be we are working on these oversamples for this thing called the Basic Screening Survey. So we're working on these oversamples in Wisconsin and Minnesota. Oftentimes, there isn't enough high-quality data for populations that make up a small proportion of the total population in the United States. So American Indians and Alaska Natives are one of those populations that there tends to not be enough high quality data and information to make effective, equitable decisions to promote the health of American Indian, Alaska Native communities. So oversamples are one way to approach that challenge. So basically what we do is for schools that have a high proportion of American Indian, Alaska Native students, we oversample those schools. So we basically do more samples in those schools so that we make sure that we have enough, statistical power to have effective, high quality results. I get to work on a bunch of really interesting projects that help with the health of American Indians and Alaska Natives and increase the available public health data. And I'm happy to go into other examples too, if you want me to.
Yeah. No, feel free. This is good. It's just to get a real good sense of kind of what you do. You don't have to worry about the nitty gritty when I say day to day, but just to really get an understanding of what you do. Tell me about the population for where you work. Is there a specific tribe, probably several tribes, but tell us a bit about the population. And then also if there is a specific challenge or focus that you're, right there in Great Lakes that you guys are focused on. Talk a bit about that.
So we serve 34 tribal nations and then 4 urban Indian organizations within Michigan, Minnesota, Wisconsin, and Chicago. So we serve a huge diversity of people, which is, really pretty incredible. And also, we don't necessarily have one focus because we're predominantly community driven and community focused organization that we're responsive to what community needs are. So predominantly as an organization, we do this thing called technical assistance, which if communities reach out and ask us for assistance conducting, for example, community health assessments or evaluations for grants, we can do that. And really just being responsive to community needs and seeing how we can support them. That's kind of our main focus. And so for the population, we serve American Indians and Alaska Natives in the Great Lakes region. So these 3 states and Chicago. And yeah, does that answer your question? I can talk some more about some of the root challenges too, if you'd like.
Yeah, please do.
I think for root causes of health inequities and challenges, there's systems are oftentimes at the root of a lot of these inequities and challenges and such. And oftentimes it's the way to solve this is making sure that we're boosting up, really increasing the power to influence decisions of those most impacted by a lot of like what some people call health challenges, what I call like opportunities for change to like improve health, right? So I think at the root, that's one of the biggest public health problems, which we're working towards and trying to address and like trying to do better with being a community driven and community responsive organization. So
got plenty to keep you busy.
There's a lot of work to be done.
Yes, I agree.
But it's fun.
Yeah. So let's shift a little bit. And I'm thinking about our listeners are pretty diverse, the folks that listen to and tune into the podcast. In your own words, how would you describe epidemiology in the work that you do with the communities you serve? And the reason I'm asking this is because sometimes it's hard for people to move away from just the textbook definition, but really the grasping the applied definition. And I think this is a great question to ask on this one specifically with an organization that, Tribal Epidemiology Center, and, you're really focused on that. So in your own words, how would you describe how, epidemiology is important in your work in the community that you serve?
Epidemiology is super important. Epidemiology is the science of public health, right? And public health is really, in my view, it's making sure that we're working towards that we're boosting everyone up to have the opportunity to live the healthiest life possible. And epidemiology is the science of how we do that, right? So I would frame it as a series of tools that help us facilitate an evidence-based conversation for how we can benefit communities or populations' health the most. And really at its core, like its fundamental core, asking questions and seeking, evidence-based answers to those questions. So questions like, will this intervention be effective? Is this disease something I should be worried about? And if it is something I should be worried about, how can I create a system or intervention to, deal with that disease? So really epidemiology is about asking questions and seeking answers to benefit communities, right?
I like that. Yeah. I love asking that question because I hear something different, from every person. And I really like the way you frame that. So thinking about, we have a diverse audience. So we may have students of different levels, undergraduate, graduate, interested in public health. We have professionals from beginner, early career professionals all the way through senior, folks that are counting down to retirement. And we have entrepreneurs. We just have a variety of people listen to the podcast. We even have people that are from other industries that are curious about public health, and they're listening to these conversations because they want to better understand what we do and so forth. So all of that being said, that's why I kind of ask a variety of these questions to kind of pull out information that I think my audience would be asking and wondering. So I kind of put myself in their shoes when I'm asking. But as we kind of begin to wrap up a little bit, do you have any advice or tip for any current public health student or graduate maybe interested in a career in public health?
Yeah, well, I guess two things. One is public health is fascinating, super diverse. There's a lot of opportunities to explore your passion and really benefit communities and populations with, getting to explore your passion. So I guess that's one thing. Public health is awesome. I'm biased, of course, and then the other thing is be curious, don't be judgmental when you get into public health. I think public health deals with a lot of challenges in a lot of different communities and populations, different types of people, and approaching that with curiosity, I think, is really beneficial. It helps us ask better questions. It helps us get to root causes of challenges more effectively. And it, opens your eyes to new ways of interpreting, viewing, creating solutions that you may not have realized before, which I think is really beneficial and can help us ask better questions and then create better solutions for people, which is the root thing of what we want to do in public health. We want to benefit people, right? So approach things with curiosity.
That's great advice. And interestingly, I've heard that a few times as well, from guests in the past. So I really think it's important. It's good advice. And especially if you think about even your own story, your own journey and how you got to where you are. I mean, you were really following your passion, following the curiosity, you're seeking answers and you were exploring. And that's really an important part of, I say, understanding public health, making it your own. Like, what does this mean for you as an individual? And then being able to decide, what you want to do with it. It's not that there's a neatly laid out plan. I mean, 15 years ago, I had no idea I'd be right here. Like 5 years ago, I didn't know I'd be right here doing what I'm doing. So I think that your advice of following your passion and remaining curious is important. Well, thank you so much for taking some time and coming on the podcast to chat with me. I have a question I wasn't planning to ask you, but I'm going to ask you anyway. You were once pre-med and, you discovered this whole public health field and made the pivot. Looking back, are you happy you did, or do you have any regrets and wish you had gone a different direction?
Do I have any regrets? Wow.
Well, maybe that's too loaded because I think we all carry some regrets for some. In the context of your public health choice.
In the context of my public health, no. Life is a journey, right? And like every part of it is like I view as an opportunity to learn. I think public health is really fascinating. I think it's really interesting to work behind the scenes, and I get to work on a lot of really interesting opportunities to try and make the world a better place. And I don't really regret any of it. I think like each of it kind of contributed to, how I'm here now. So no, I don't regret getting into public health. I think it's really interesting and fascinating. So I think more people should be in public health, because it's going to contribute to making the world a little bit better and healthier, thriving place. So yeah, I hope that answers that.
Yeah. I was just really curious since we were talking about that from the beginning and even then chatting a little bit before we started recording, hearing your full story. I was just, curious if you're happy with the decision you made. So you definitely answered that question.
Happy to be in public health.
I appreciate you for being here. And so thank you again for taking some time, sharing your journey and the work that you're doing at the Great Lakes.
Thank you for giving me the opportunity to be here. It's great talking to you.
Oh, likewise. I really hope you enjoyed that conversation as much as I did and found value in the advice and insights that Erik shared. I do encourage you to explore the Tribal Epidemiology Centers and specifically the Great Lakes Intertribal Epidemiology Center to learn more about what Erik shared with us on this episode. I'd like to point out that there is also a tab on the main Tribal Epidemiology Center website to explore internships and employment opportunities. We've gathered all of the links together in one place on the show notes page to make it easy for you to access. To find the links to their websites and other resources mentioned in our conversation, just visit the show notes page for this episode, which is episode 306. Go to phecpodcast.com, and from there, just navigate to episode 306, and you'll find the show notes. One more thing before we go. Please take a moment and share this episode with a friend. I'm sure you know at least one person who would be interested in hearing this conversation. If you're listening now and you're in one of our podcast apps, then it's really easy to share the episode through a text or share it in a post on social media. If you're on our website, at the bottom of the show notes page, you'll find social sharing buttons, which also make it really easy to share the episode with your network. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening to the Public Health Epidemiology Conversations podcast. Visit phecpodcast.com to find the show notes for each episode and to learn how to work with me.